Welcome and thank you for standing by. All lines have been placed in a listen-only mode for today's presentation. The call is being recorded. If you have any objections, you may disconnect at this time. I will now introduce your conference host, Mr. Michael Cook. You may begin.
Good morning, and thank you for joining us. I am Michael Cook, Chief of the Public Information Office at the U.S. Census Bureau. Today we're releasing the latest income, poverty, and health insurance findings for the nation. We'll have 4 presenters today to cover these topics. Immediately after the presentations, we'll open up the phone lines to answer your questions from reporters. This live question and answer session is for the media only. By the way, resources for today's news conference can be found on census.gov, including the slide decks from today's presentation. This deck will be part of an income, poverty, and insurance health insurance press kit. To find the press kit, look for the Information For tab at the top of the Census Bureau webpage and click on Media Newsroom. The press kits are listed on the left side of the website. Without further delay, I'd like to turn it over to our first speaker, David Waddington, Chief of our Social and Economic and Housing Statistics Division. David?
Good morning, and thank you for joining us. Today we are releasing 3 reports: Income and Poverty in the United States, the Supplemental Poverty Measure 2020, and Health Insurance Coverage in the United States 2020. These reports are based on data from the Current Population Survey's Annual Social and Economic Supplement, or CPS-ASEC. The Current Population Survey is the longest-running survey conducted by the Census Bureau and is the official source of national poverty estimates. Now let's take a look at the main findings. Real median household income decreased 2.9% to $67,500 between 2019 and 2020. The official poverty rate in 2020 was 11.4%, up 1 percentage point from 2019. In 2020, there was 37.2 million people in poverty, an increase of 3.3 million people from 2019. The Supplemental Poverty Measure, or SPM, extends the official poverty measure to include the value of non-cash benefits, stimulus payments, taxes, and other necessary expenses. The SPM rate in 2020 was 9.1%. This was 2.6 percentage points lower than 2019. The percentage of people with health insurance coverage for some or all of calendar year 2020 was 91.4%. Now let's turn to our subject matter experts to take a closer look at the findings, beginning with Trudy Renwick, who will start with income and poverty. And as a reminder, immediately following these presentations, we'll take your questions.
Thank you, Dave. Good morning. Income and poverty statistics help us to gauge the health of the U.S. economy. Let's begin by discussing what is money income. Most of the estimates in my presentation are based on money income, which is a measure of all cash or money resources coming into a household. It includes wages and earnings from work, as well as Social Security benefits, unemployment compensation, retirement income, interest, dividends, and public assistance. It is calculated pre-tax and therefore does not account for taxes paid, tax credits such as the Earned Income Tax Credit, the Child Tax Credit, and special COVID-19 related stimulus payments, nor non-cash assistance such as SNAP benefits, Medicaid, and Medicare. Let me begin by summarizing the main findings regarding changes to household income, earnings, and work experience between 2019 and 2020. Real median household income decreased 2.9%. The median is the point that divides the household income distribution into halves, one half with income above the median and the other with income below the median. The total number of workers with earnings decreased by about 3 million. The number of those who worked full-time year-round decreased by approximately 13.7 million, the largest year-to-year decrease since we began collecting comparable data in 1967. The real median earnings of all workers decreased 1.2%, while the real median earnings of those who worked full-time year-round increased 6.9%. Let's look at some more details about the changes we observed in household median income. This chart shows median household income from 1967 to 2020 in real inflation-adjusted dollars. Median household income decreased 2.9% from 69,600 in 2019 to 67,500 in 2020. This is the first statistically significant decline in median household income since 2011. During 2020, the United States experienced a recession. Recessions, as defined by the National Bureau of Economic Research, NBER, are depicted in this and all time series charts in light shading. As determined by NBER, a recession began in March 2020 and ended in April 2020. The decline in median income between 2019 and 2020 was not statistically different from the declines experienced during the Great Recession from 2007 to 2009 and the previous recession from 2000 to 2001. Now looking at income by race and Hispanic origin. The 2020 real median incomes of non-Hispanic white, Asian, and Hispanic households decreased from their 2019 medians, while the change for Black households was not statistically significant. These declines amounted to changes of 2.7% for non-Hispanic white households, 4.5% for Asian households, and 2.6% for Hispanic households. The 2020 median household income estimates were lower than 2019 for householders with a householder under 65 years of age and for those with a householder 65 years and older. For both native-born and foreign-born households, for households in the Midwest, the South, and the West, and for households within metropolitan statistical areas, or MSAs, both inside and outside principal cities. The changes in median income for households in the Northeast and those outside MSAs were not statistically significant. Using information about the distribution of household income, we can produce a Gini index, a statistical measure of income inequality ranging from 0 to 1. It measures the amount that any two incomes differ, on average, relative to mean income. It is an indicator of how far apart or spread out incomes are from one another. A value of 0 represents perfect equality, and a value of 1 indicates total inequality. The money income Gini index was 0.489 for 2020, not statistically different from 2019. As noted earlier, these estimates are based on money income before taxes and tax credits. Given the importance of the 2020 COVID-related changes to tax credits, particularly the first two rounds of economic impact payments, this year we have provided an appendix to this report that compares pre-tax to post-tax median household income and income inequality measures. As expected, taking into account all taxes and credits lowered median household income and, given the progressive structure of our income tax system, decreased inequality as measured by the Gini index. Post-tax median household income was 7% lower than pre-tax, while the post-tax Gini index was 12.3% lower than the pre-tax Gini index. In a year without significant changes to taxes or credits, we would expect the effect of taxes and credits to change the levels of median household income and the Gini index, but not the year-to-year trends. This was the case between 2018 and 2019. However, we can see on this slide that the effect of taxes and credits in 2020 changed the year-to-year trends for both median household income and the Gini index. After taxes and credits, the median household income increased 4% between 2019 and 2020. Inequality, as measured by the Gini index, decreased by 3.1%. These next slides switch to earnings and work experience data for people aged 15 and older. Between 2019 and 2020, the total number of workers decreased by approximately 3 million. The decrease was equally distributed across men and women. There was a decrease of about 13.7 million full-time year-round workers between 2019 and 2020. This is the largest year-to-year decline in full-time year-round workers since 1967, the first year for which there's comparable data. The number of female full-time year-round workers decreased by about 6.2 million between 2019 and 2020, while the decrease in the number of their male counterparts was approximately 7.5 million. The decline of 13.7 million full-time year-round workers compared to the decline of about 3 million total workers, regardless of work experience, suggests that many workers shifted from working full-time year-round in 2019 to part-time or part-year work in 2020. Here we see historical data on the real median earnings of all workers and full-time year-round workers from 1960 to 2020. Earnings are the sum of wages, salary, and self-employment income. In 2020, about 76% of aggregate income came from earnings. The 2020 median earnings of working women decreased 1.2% from their 2019 median, while the change for their male counterparts was not statistically significant. In 2020, the real median earnings of those who worked full-time year-round increased 6.9% from their 2019 estimate. Median earnings increased for both men and women who worked full-time year-round. Here we see the female-to-male earnings ratio historically. The female-to-male earnings ratio compares the median earnings of women working full-time year-round to the median earnings of men working full-time year-round. Median earnings of men who worked full-time year-round were $61,400, while the median for women was $51,000. The 2020 female-to-male earnings ratio was 83.0%, not statistically different from the 2019 ratio. Year-to-year changes in this ratio are not common. Here we compare changes in median earnings and the number of workers during the most recent recession to the changes during the Great Recession from 2007 to 2009. The most recent recession officially ended after 2 months, while the Great Recession lasted 18 months. Real median earnings for all workers declined more during the Great Recession, 4%, than between 2019 and 2020. On the other hand, for full-time year-round workers, median earnings declined between 2007 and 2009, but increased from 2019 to 2020. The percent decline in the number of total workers was greater during the Great Recession, 2.4%, than between 2019 and 2020, 1.7%. But the percent decline in the total number of those working full-time year-round was smaller during the Great Recession, 8.6%, than between 2019 and 2020, 11.5%. The 6.9% increase in median earnings of full-time year-round workers, coupled with the 11.5% decline in the number of full-time year-round workers between 2019 and 2020, suggests that many of the full-time year-round jobs that were lost were at the lower end of the income distribution. This slide compares the share of all full-time year-round job losses by earnings below $34,000, or approximately the 25th percentile, in the most recent recession to the share in the 2007 to 2009 recession. During the Great Recession, about 35% of the full-year full-time job losses were from jobs in the lowest quartile of the earnings distribution. In contrast, almost 54% of the full-year full-time jobs lost last year paid less than $34,000 per year. Now let's turn our attention to official poverty. Here are the highlights from the report. The official poverty rate in 2020 was 11.4%, up 1 percentage point from 10.5% in 2019. This is the first increase in poverty after 5 consecutive annual declines. In 2020, there were 37.2 million people in official poverty, approximately 3.3 million more than in 2019. Following the Office of Management and Budget's Statistical Policy Directive 14, the Census Bureau uses a set of money income thresholds that vary by family size and composition to determine who is in official poverty. In 2020, a family with 2 adults and 2 children was categorized as in official poverty if their income was less than $26,246. This slide shows the official poverty rate and the number of people in poverty going back to 1959, the first year for which we have estimates. As you can see from this chart, the 2020 poverty rate of 11.4% was the first increase following 5 years of decline. Here we demonstrate differences in official poverty trends for people across race and Hispanic origin groups. Between 2019 and 2020, the poverty rate for non-Hispanic white individuals was lower than the poverty rate for Black and Hispanic individuals, but was not statistically different from the poverty rate for Asian individuals in 2020. The poverty rate for non-Hispanic white individuals increased by 0.9 percentage points, while the poverty rate for Hispanic individuals increased by 1.3 percentage points. For both Asian and Black individuals, the poverty rates were not statistically different from 2019. This slide looks at official poverty rates by age. Between 2019 and 2020, poverty rates rose for individuals under 18 and people aged 18 to 64. For individuals under age 18, 16.1% were in poverty. Poverty increased to 10.4% for people aged 18 to 64. People aged 65 and older had a poverty rate of 9%, which was not statistically different from 2019. In this slide, we look at official poverty rates for all families from 1959 to 2020. Between 2019 and 2020, the poverty rate for families increased from 7.8% to 8.7%. We now add the poverty rates for the Census Bureau's three major family classifications: married couple families, male householder no spouse present families, and female householder no spouse present families. Poverty rates increased for all primary family types, except for those with a male householder. The poverty rate for married couple families was 4.7%. The poverty rate for female householder families in 2020 was 23.4%. The poverty rates for female householder families increased in 2020 after declining for the previous 5 years. The gap in official poverty rates between married couple families and female householder families has decreased from 26.9 percentage points in 1973 to 18.7 percentage points in 2020. Between 2019 and 2020, official poverty rates increased for many major demographic groups, including both men and women, both native-born individuals and foreign-born individuals, those living in the South and the West, and individuals living inside metropolitan statistical areas. For more information on income and official poverty statistics in the United States in 2020, please visit our website, where you can find detailed and historical income and official poverty tables, as well as official poverty thresholds for 2020 by family composition. Additionally, please see the America Counts and Research Matters stories released today, providing additional insights on income and official poverty in 2020. Next, Liana Fox will summarize the findings for the supplemental poverty measure. Liana?
Thank you, Trudy. The Supplemental Poverty Measure, or SPM report, is based on data from the CPS-ASEC. The SPM extends the official poverty measure by taking into account many of the government programs designed to assist low-income families and individuals that are not included in the official measure. Non-cash benefits such as housing or nutritional assistance are added to pre-tax cash income, while necessary expenses such as taxes, work, and medical expenses are subtracted. The first two rounds of stimulus payments are included in SPM resources for 2020. The SPM does not replace the official poverty measure and is not used to determine eligibility for government programs. In 2020, several methodological improvements were applied to both the resource and threshold estimation of the SPM. Details of those improvements are available in the report appendix. All 2019 and 2020 estimates in this report reflect implementation of the revised SPM methodology. Let me begin by summarizing the main findings from this report. The SPM rate in 2020 was 9.1%. This was 2.6 percentage points lower than 2019 and the lowest rate since estimates were initially published for 2009. The SPM rate for 2020 was 2.3 percentage points lower than the official poverty rate of 11.4%. This is the first time in the history of the SPM that poverty is lower using the SPM than the official measure. Stimulus payments enacted as part of the economic relief legislation related to the COVID-19 pandemic moved 11.7 million people out of poverty. Unemployment insurance benefits, also expanded during 2020, prevented 5.5 million people from falling into poverty. The SPM uses thresholds produced by the Bureau of Labor Statistics from Consumer Expenditure Survey data. Separate thresholds are created for renters, homeowners with a mortgage, and those who own their homes free and clear. While the official poverty threshold is constant throughout the United States, the SPM adjusts for geographic differences in housing costs. This map shows those differences, with yellow areas having lower thresholds for renters than the official poverty threshold, and blue and green areas having higher thresholds. This slide compares the SPM estimates for 2020 with 2019 for all people and by age group. The 2020 SPM rate for the entire population was 9.1%. SPM rates were down for all major age categories in 2020 compared to 2019. In 2020, children under age 18 had an SPM rate of 9.7%. Adults aged 18 to 64 had a rate of 8.8%, and adults aged 65 and older had a rate of 9.5%. Census Bureau estimates for the SPM are available back to 2009. SPM rates in 2020 were at their lowest level since 2009, even after adjusting for survey redesign, processing system, and methodological changes. Since the SPM's initial production, the SPM rate has been higher than the official poverty rate, ranging from 0.6 to 1.6 percentage points higher than the official measure over this period. In contrast, in 2020, the SPM was 2.3 percentage points lower than the official measure. The main driver of this difference is the inclusion of stimulus payments in 2020. In the absence of stimulus payments, the overall SPM rate would have been 12.7%, which was higher than the official measure. This slide compares SPM estimates for 2020 with the official poverty estimates for all people and by age group. The 2020 SPM rate for the entire population was 2.3 percentage points lower than the 2020 official poverty rate. Looking at specific age categories, the SPM was lower than the official poverty rate for children and for people aged 18 to 64, but higher than the official poverty rate for people aged 65 and older. This slide shows SPM rates over time for individuals categorized by race and Hispanic origin groups. Between 2019 and 2020, all major groups shown in this figure experienced a decline in poverty. SPM rates in 2020 were also at their lowest level since 2009 for all groups shown. In 2020, the SPM rate for Blacks was 14.6%, 14% for Hispanics, 8.8% for Asians, and 6.5% for non-Hispanic whites. While the SPM national poverty rate was lower than the official in 2020, that difference varied by geographic area. This figure shows the United States divided into 3 categories by state. There were 11 states plus the District of Columbia where SPM rates were higher than official. These are shaded blue. There were 30 states where SPM was lower than official. These are shaded orange. And finally, there were 9 states where the differences in the rates were not statistically significant. These are gray. One important contribution that the SPM provides is allowing us to gauge the effectiveness of tax credits and transfers in alleviating poverty. We can also examine the effects of non-discretionary expenses such as work and medical expenses. This graph shows the impact on the 2020 SPM rate of the addition or subtraction of a single resource element. Some of these elements, such as Social Security and unemployment insurance, are included in the official poverty estimates. Other elements, such as stimulus payments and refundable tax credits, are included only in the SPM resource measure. Using this chart, we can see that 26.5 million people were taken out of poverty by Social Security benefits. This figure also shows the breakdown by age, with the majority of individuals taken out of poverty by Social Security aged 65 and older. 11.7 million people were taken out of poverty by the first 2 rounds of stimulus payments. 5.5 million people were taken out of poverty by unemployment insurance benefits, which were expanded in 2020. However, subtracting medical expenses from income increased the number of people in poverty by 5 million using the SPM. For more information on the supplemental poverty measure, please see the report as well as additional tables, blogs, and working papers available online. Next, Sharon Stern will summarize the findings for health insurance.
Thank you, Liana. Health insurance is an important measure of our nation's overall well-being. Whether it's for illness, injury, or preventative needs, health insurance provides greater access to medical care, protection from high unexpected costs, and more economic stability. Each year, the Census Bureau provides data on health insurance coverage. We look at who is and isn't covered and what type of insurance they have. Let me begin by summarizing the main findings this year. An estimated 8.6% of the population, or about 28 million people, did not have health insurance at any point in 2020. 66.5% of people were covered by private insurance at some point during the year. 34.8% of people were covered by public coverage in 2020. In 2020, most people, 91.4%, had health insurance at some point during the calendar year. Looking at private more closely, employer-based insurance was the most common subtype of coverage overall, covering 54.4% of the population. 10.5% of the people purchased their coverage directly. Turning to public coverage, in 2020, 34.8% of people had public coverage, which includes Medicare, 18.4%, Medicaid, 17.8%, and VA and CHAMP VA, 0.9%. Changes in health coverage from year to year reflect changing economic conditions, demographic shifts such as population aging, and federal and state policy changes that affect access to care. Health insurance rates in 2020 may have been affected by economic recession, but additional forces may also have impacted estimates of coverage. In the next slides, we report on changes in health coverage rates between 2018 and 2020. Estimates for 2018 were collected in 2019 prior to the pandemic, and estimates for 2020 were collected in 2021 after many of the COVID-related changes to data collection were lifted. People are only considered uninsured if they had no coverage for all 12 months of 2020. This means that if someone had health insurance in early 2020 and lost coverage during the economic recession, they are not counted as uninsured by this measurement. At the same time, people are counted as having coverage if they had coverage for even one day. Furthermore, people may have more than one coverage during the year or at the same time. As shown on this slide, there was no statistically significant change in the uninsured rate between 2018 and 2020. Although we see no change in the uninsured rate, there were changes in the types of insurance people held. Fewer people had private insurance in 2020 than in 2018. This was driven by a 0.4 percentage point drop in employment-based insurance and a 0.3 percentage point drop in direct purchase insurance. There was an increase in public coverage between 2018 and 2020. This was driven by a 0.5 percentage point increase in Medicare coverage, likely due to population aging. Age is strongly associated with the likelihood that a person has health insurance. Children may be covered by their parents' health insurance up to the age of 25. In addition, children under the age of 19 may qualify for certain programs, such as the Children's Health Insurance Program, or CHIP, for which working-age adults are not eligible. In both 2018 and 2020, uninsured rates were lower for children and for those 65 and older than for other age groups. However, there was no change in the uninsured rate for any age group between 2018 and 2020. Although there was no change in the insured rate for all children under 19, there were changes across race groups over this period. For example, the uninsured rate among Black children increased 1.4 percentage points to 6% in 2020. Asian children saw a decrease in the uninsured rate. There was no change in the uninsured rate for working-age adults by the race and origin groups shown. Changes in the uninsured rate were also not distributed equally by income to poverty ratio for children and working-age adults. This chart shows three groups: those with incomes below their poverty threshold, those with income at or above their poverty threshold and below 400% of the poverty threshold, and those with incomes at or above 400%. Children in poverty experienced a 1.6 percentage point increase in their uninsured rates to 9.3% in 2020, while the uninsured rate declined for children with family incomes above 400% of poverty. Among working-age adults, the uninsured rate rose 1 percentage point during this period for those with incomes in the middle group. There was no change in the uninsured rate for working-age adults in either of the other two groups. As shown on the left-hand side of this slide, there was a decline in the number of workers employed full-time year-round between 2018 and 2020, and an increase in the less than full-time year-round workers. Together, this suggests that many workers shifted from working full-time year-round to part-time or part-year in 2020. This shift in the composition of the workforce was accompanied by a change in the uninsured rate. For full-time, full-year workers, the uninsured rate was 8.4% in 2020, lower than in 2018. The uninsured rate for those employed less than full-time year-round increased to 16.4% in 2020. More information is available in our reports and online. Now I'll turn it back to Dave Waddington.
Thank you, Sharon. And that concludes our presentations. To recap the highlights, real median household income decreased 2.9% to $67,500 between 2019 and 2020. The official poverty rate in 2020 was 11.4%, up 1 percentage point from 2019. The supplemental poverty measure rate in 2019 was 9.1%. This was 2.6 percentage points lower than 2019. And the percentage of people with health insurance coverage for some or all of the calendar year was 91.4%. More information is available in our reports and online. We have a number of detailed and historical tables on our website, as well as additional analysis in our Research Matters blog on the effect of COVID-19 on response rates, the difference between official poverty and SPM, and an in-depth look at annual health insurance coverage. We are also releasing a number of America Count stories that go into more depth on specific issues. These include the impact of expanded unemployment benefits, the distribution of earnings by occupation and industry of full-time year-round job losses, the impact of stimulus payments, analysis of health insurance coverage for working-age adults and uninsured rates for children, and we also have a story describing the ways that census surveys and programs can provide insight into social, economic, and housing equity gaps. And now I'll turn things back over to Michael, who will lead our question and answer session.
Thanks, David. We'll start taking questions now. To fit in as many questions as possible, reporters can ask one question and one follow-up. Operator, can you please give instructions on how reporters can submit their questions?
We will now begin our formal question and answer session. If you would like to ask your question, please unmute your phone, press star 1 on your telephone keypad, and record your first and last name. To withdraw your question, you may press star 2. Once again, to ask your question, please press star 1 on your telephone keypad.
While we wait for the first question to queue up, a reminder to check out our press kit for those who may have logged on late and didn't hear the beginning, but also to remind folks that it contains today's slide deck, the complete presentation, our news release, and reports on today's topics. We also are posting a recording of today's news conference in the next 48 hours or so. So as a reminder, visit America Counts, story behind the numbers on census.gov for all of the news stories on the latest income, poverty, and health insurance findings today. In October, we'll release an analytical report on the data quality challenges to the 2020 American Community Survey. Stay tuned for more information on that. And then in November, we'll release the 2020 American Community Survey 1-year experimental estimates, along with a working paper describing the methodology to produce these statistics. Operator, by chance, do we have our first question?
We do have our first question. It is coming from Tammy Luby of CNN. Your line is open.
Hi, can you hear me?
We can. Hi, Tammy.
Great, thank you. One clarification and one question. Sharon, you mentioned that employer coverage was down. You had said 0.4 on the call, but the slide said 0.7. I just wanted to clarify that. And then also, can you talk at all about why Medicaid coverage, I think it showed it decreased by 0.1?
Thank you for your question. Let me look, because I may have misspoken. So I think thank you for asking me to clarify if there was an inconsistency. Can you tell me again which slide it was that you were looking at?
Sharon, I can jump in there, too. It was 0.7 is the correct number.
Oh, yes, it is. I see it.
It was 0.7 for employment-based.
Yeah, I see it in my script. If I misspoke, I apologize. That was
And then just to clarify, can you explain at all, Medicaid may have gone down at a time when under Families First, they couldn't reduce coverage, or they couldn't kick people off, and you mentioned that 4 states had Medicaid expansion. 3 states.
Okay, I didn't comment on Medicaid expansion states. And there was no statistically significant difference between 2018 and 2020 for the number of people covered by Medicaid. I want to look at my notes and make sure I'm saying correctly the right thing. I believe, well, I don't have any notes on that. If there's additional confusion, I can look into it and get back to you after the press conference, if that's okay.
And Tammy, what we can do, this is Mike, I'm going to jump in here. Tammy, we'll reach out to you, or you can contact us at the Public Information Office, 301-763-3030, and we'll make sure and square this away immediately after the press conference or even during it. But just reach out to us. Yeah.
I didn't have a specific, like a clarification question on Medicaid. I was just wondering why, if you had any insight into why Medicaid coverage may have declined last year.
Okay, thank you. Yes, according to our statistics between 2018 and 2020, it did not decline. There was no statistical change.
Sorry, yes, thank you for that clarification.
And just one reminder for the callers, if you could, when you hit *1 to talk, if you could turn down the computer audio. We're getting a little bit of feedback when you're actually asking your question. And operator, we are now ready for our next question.
And the next question is coming from Janelle Marti of Reuters. Your line is open.
Hi, thank you for taking our question. So I was wondering if you could just please speak a little bit to the differences between the SPM, Supplemental Poverty Measure poverty rate, and the official poverty rate. We haven't had that much time yet to dig into the report, so I just wanted to clarify if the SPM is where, once you take into account, it sounds like the unemployment benefits and the stimulus checks, that would be the poverty rate. And then if we didn't have that government income, then it would be the official poverty rate of 11.4%.
Thanks for that. Yes. Thanks for that question, Janelle. I'm going to toss it over to Liana to address that clarification on SPM and the official measure of poverty. Liana?
Hi, Janelle. Thank you for that question. So there's a number of differences between the official poverty measure and the SPM. The official poverty measure is just cash income, while the SPM also includes the value of non-cash benefits. So that's the value of housing subsidies, nutritional subsidies, that's SNAP, school lunch, WIC. It also adds in energy assistance. It subtracts out taxes paid or adds in tax credits. And so that would include EITC or child tax credit. It subtracts out other necessary expenses such as work and child support paid, as well as medical expenses. So there's differences in those two measures. So unemployment insurance is included in the official, that's cash income, so that's included in both the official and the supplemental, but stimulus payments, as you mentioned, are just included in the SPM. The SPM also has thresholds that vary by geography, so it accounts for differences in costs for housing costs throughout the country. So there's a number of other differences there. I hope that answers your question.
My follow-up question would be if you had any comment on what would be the biggest driver to push down the increase in the SPM poverty rate, noting those differences.
Sure. So this slide right here tells you the number of people lifted out of poverty by each of the programs. So Social Security is the largest anti-poverty program that we capture. That's captured in both the official poverty measure and the SPM. Followed, the second one is the first two rounds of the stimulus payments. So the stimulus checks that were sent out in 2020, or covering calendar year 2020, reduced the number of people in poverty by 11.7 million.
Thanks for that. And operator, do we have our next question?
Yes, our next question is coming from Margot Singer-Katz of the New York Times. Your line is open.
Hi. I just wanted to follow up on Tammy's question. Administrative data from the Centers for Medicare and Medicaid Services show that there was a 14% enrollment increase in Medicaid that took place between February 2020 and January 2021. So not exactly the same time frame that you guys are measuring, but very close. I'm just asking again, how do you think it's possible that we know there was such a large increase in the number of people with Medicaid coverage, but there seems to be no increase in the percentage of the population enrolled in Medicaid in your survey data? Can you help explain why that might be?
Thanks for that question on Medicaid, Margot. I'm going to toss that back over to Sharon. Sharon?
Yeah, thank you very much. I appreciate that. The CMS data are based on the actual records from people enrolled in coverage, and our CPS-ASEC estimates are based on reports of coverage from a sample of the civilian non-institutionalized population. We ask them if they are covered at any time during the year. We track their coverage. But I have to point you to a recent blog that may explain why there's not a bigger, if you are expecting a magnitude that you didn't see. We have a blog that comes out today that talks about the effects of data collection during the pandemic last year and during collection in this year. And that finds that while response rates have rebounded since last year, so 2021, they're higher than they were in 2020. They're still lower than prior to the pandemic, and we still have non-response bias that is not as low as it was prior to the pandemic, but it is less than last year. I think I've summarized their findings correctly, and that may play a part in it, but there are a lot of different elements that can affect health insurance coverage and how we measure it. Again, we have a slightly different population than the CMS records have. So I hope that helps you understand the differences.
I just want to clarify, so do you think that you may have some response rate problem where you're undercounting the population that would have gained Medicaid coverage in this period?
I wouldn't express it as a problem, but I would say that their research shows that the characteristics of people that we interviewed have a greater likelihood of holding coverage and a lower likelihood of Medicaid. So that can be one of the elements that affects the magnitude of our estimates this year.
Okay. Thank you.
Thanks for that. And operator, do we have our next question?
The next question is coming from Katie Johnston of Boston Globe. Your line is open.
Hi there. Thanks for doing this. I wondered if you could talk about the 11 states where the supplemental poverty rate is higher than the official poverty rate. I think Massachusetts was one of those, and what the difference might be there.
Thanks for that question on SPM, Katie. I'm going to toss that over to Liana.
Hi, Katie. Thanks for that question. So the 11 states where the SPM was higher than official, I'm just going to read because it's harder for me to look at the map, were California, Colorado, Delaware, Florida, Hawaii, Maryland, Massachusetts, New Hampshire, New Jersey, New York, and Virginia, as well as D.C. So it could be a range of factors that influence, that make the SPM higher than official. It could be differences in geographic adjustments. So the housing costs may be higher in those areas, so they would have higher thresholds. There could be different mixes of housing tenure because we give different thresholds based on whether you own your home outright, whether you're a renter, or whether you have a mortgage. There could also be differences in demographics or discretionary expenses such as medical expenses. So really it's hard to disentangle. There's a lot of different factors that drive differences between official and SPM rates by state.
Okay, got it. Thank you.
All right. Operator, can we have our next question?
And the next question is coming from Heather Long of Washington Post. Your line is open.
Hi, thank you. Hey, can you all just address any concerns and just broad comments overall on response rates in the survey this year? What should we be noting in our stories in terms of giving people some context on, any potential pitfalls of this data, for lack of a better word?
Thanks for that, Heather. I'm going to toss that question over to David to talk a little bit about the survey itself, the methodology, and how we conducted it this year and what came to bear. Dave?
Yeah, great. Thank you, Michael. Yeah, and it's a good question. I mean, as we talked last year about some of the impacts of the COVID-19 pandemic and the operations on data collection last year, and as Sharon mentioned earlier, much of the changes that we had to enact in 2020 have been sort of reinstituted back to our normal data collection procedures. So as you can see on this graph here, that there was a pretty substantial drop in response rates back in March of 2020. We have rebounded and we've gone back to most of these data were collected. These data were all collected between February and April of this year, and we were pretty much back to 100% normal operations in terms of contacting and personal contact for our interviews for the CPS ASEC. So we did see, and as you can see on there, the response rates have gone back up. They're not quite to what they used to be. They're not, we'd always like to have a higher response rate, so encourage people to respond. And we also have an America Count story, or maybe it might be a Research Matters blog, actually, that comes out today that discusses this again. It updates the blog we did last year where we talked about the impact of data collection and response rates and non-response bias. So I encourage you to take a look at that and see if that will help provide more information. And we're certainly happy to talk more in depth offline if you'd like as well.
Thanks for that, Dave. Also, one quick reminder for folks that are calling in, reporters, if you don't get a chance to ask your particular question or you have additional follow-ups, just a quick reminder to reach out to us at the Public Information Office. You can simply email us at pio@census.gov or give us a call at 301-763-3030. Operator, can we have our next caller?
And the next caller is coming from Ben Castleman, The New York Times. Your line is open.
Yes, thank you very much for taking my call and for doing this. A question regarding the SPM and the impact of the various government programs here. Am I right in understanding that those programs are not, that those figures are not additive? And is there a way to understand, we'd like to sort of add up the various pandemic era programs, but obviously people received both the stimulus payments and unemployment insurance, et cetera, SNAP in many cases, and so trying to understand if there's a way to sum those up in a useful way.
Thanks for that, Ben. That question on SPM, I'm going to toss that right back over to Liana.
Hi, Ben. Thanks for that question. You are correct that each one of these is just the individual subtraction. So this is just subtracting stimulus. So none of these are additive. We release a public use microdata file that will be posted. If it's not already online, it should be online shortly, where you could actually, I know that you can't do that right now, but you could sum up all the different programs and subtract them together. But really, I guess that's the main way to do that is to actually go to the microdata and add things up. It will be a little tricky, right, because some of the programs like unemployment insurance captures our regular pre-COVID unemployment insurance as well as the expansions. So disentangling what was standard unemployment insurance versus some expansions would be pretty complicated. But there is a way that you could go into the microdata and do that analysis. Happy to talk more for follow-up.
Was hoping that wouldn't be the answer, but thank you.
Sorry.
Thanks for that. Operator, by chance, do we have another question?
We have no further questions in queue at this time.
And just one last reminder before we wrap, if you do have a question, you can press *1 to ask that question. I'll give it a couple of moments before we close out. Any other questions, operator?
And we do have a question coming through. Katie Johnston, the Boston Globe. Your line is open.
Great, thanks. Hi, Katie.
Hi there. Thanks for taking one more. I just wondered if any of you could give your thoughts on the overall data and, what it means. Is it surprising? Is it in line with what you thought it would be? I mean, any overall takeaways that you can share with us?
And I'm going to toss that to the group, this last question. Any thoughts on that from your respective areas? Leanna?
I guess I could just jump in and say, from the perspective of the SPM, I think this really shows the importance of the social safety net, right? When we see differences in trends with the official poverty rate and the SPM, and that's really the impact of our tax system, that's the impact of our non-cash benefits. So I think this really highlights the importance of our social safety net.
And I'd like to add, I think it's very interesting to note, and certainly Trudy talks about it in her presentation, the shift of workers from full-time year-round to less than full-time year-round, and what that implies about earnings and health insurance. So, for instance, full-time year-round workers had an increase in private coverage to 87%, and less than full-time year-round workers had a decrease in private coverage. And I think this is part of the overall story about jobs shifting and the changing nature of work as it was in 2020. I think that's a really interesting and important thing that these reports can show.
And I would just add that the drop in full-time year-round work seems consistent with what we all saw and experienced in the economy in 2020, with people at least temporarily losing their jobs or having their hours cut back. So that large decrease in full-time year-round workers was consistent with what was going on with the pandemic. And as Sharon noted, it wasn't evenly distributed across the earnings distribution. It was really concentrated at the bottom of the earnings distribution.
And I think I'll just say, I think this is a really particularly interesting year because of the data collection challenges we had last year, and some of those continued this year, but not to the extent of last year. And for our country going through a pandemic, I think there's going to be a lot of things to dig into this data, and I think piecing out some of these things is really going to be informative. And I hope that you'll take time to look at our America Count stories that actually dig into some of those topics, such as the unemployment, expanded unemployment benefits, and how that affected poverty rate. And I think digging into some of those things, as well as the job losses with those stories, hopefully will provide some more insight. And if there's more things that we can provide, we're happy to see where we can help.
And there we have it. Before we wrap, I'd like to direct your attention to a few key products we have scheduled for release this week. This Thursday, September 16th, we'll be releasing data from the 2019 Survey of Income and Program Participation, otherwise known as SIP. Also this Thursday, we'll be uploading the data from the 2020 Census Redistricting Data Summary Files to our user-friendly website, data.census.gov. This is the same data we released last month, but now in an easier-to-use data dissemination tool for the public. A final note. If you have additional questions after today's news conference, or you'd like to arrange an interview with one of our subject matter experts, please call the Public Information Office at 301-763-3030, or you can email us at pio@census.gov. I'd like to thank today's presenters, David Waddington, Trudy Renwick, Sharon Stern, and Leanna Fox. I'm Michael Cook. Thank you for joining us for today's news conference. Have a great rest of your day.